Hey there, everyone, and welcome back for part two of the EKG Basics series. My name is Austin Kaiser. I'm a flight paramedic and the clinical educator with PHI over here in California. Part two is about abnormal cardiac rhythm. So we're going to be looking at a few abnormal like blocks and how to tell the difference between a left bundle branch block and a right bundle branch block, which is probably the most common question that I get as far as basic dysrhythmias is telling the difference between a left bundle and a right bundle. So we're going to hopefully clarify that a little bit today. So looking at a bundle branch block, first is that it can only be diagnosed from a 12 lead. You cannot diagnose it from a 3 lead or a 4 lead. You can have a high index of suspicion that there is a bundle branch block, but you cannot definitively diagnose it unless you look at a 12 lead. And more specifically, you need to be looking at V1 on the 12 lead. V6 can also be very helpful to determine if it's a left versus a right, but V1 is really all you need to look at. So the only criteria for you to be able to have a bundle branch block is that lead V1, the QRS complex in lead V1, has to be wider than 3 little boxes. It has to be wider than 0.12 seconds, and you have a bundle branch block. Now, to be able to tell the difference between a left bundle and a right bundle, you just need to look at the QRS complex. Does it end with an S wave? If yes, then it's a left bundle. Does it end with an R wave? If yes, then it's a right bundle. So a left bundle branch block will have a terminal S wave, terminal meaning that's how the wave ends, and then a right bundle branch block will have a terminal R wave. So if we're looking at these, remember that in order to have a bundle branch block, the QRS complex has to be wider than 3 little boxes. So it just has to be 0.12 seconds or greater, or excuse me, it needs to be greater than 0.12 seconds. And we look at this first one right here. So when you're thinking about a QRS complex, if you are coming out from the isoelectric line, let's look at the wave all the way to the right, the one that is under that right bundle branch block characteristics, the V6 waveform. If you're coming out from the isoelectric line, you see the little P wave, and then you see that PR interval, and then the first deflection from the wave goes down, and that means that it's going to be a Q wave. So it's a Q, and then an R, and then an S. So the first negative deflection is a Q wave. The first positive deflection is going to be an R wave, and then as it dips back down below the isoelectric line, we now have an S wave. So we have an actual QRS complex. But many QRS complexes are not a Q, then an R, then an S. So let's look at the V6 lead on the left bundle branch block characteristics. We see that P wave, and then we see the first deflection off of the isoelectric line is a positive. So we have an R wave, and we have those little bunny ears at the top of the R wave, and then as the R wave comes down, it never dips below the isoelectric line, so it never becomes an S. So that is just an R wave. So now let's actually look at V1, the actual important lead for being able to determine if we have a left or a right bundle branch block. So we see from the isoelectric line, the first deflection we have is positive, so we have an R wave. And then it dips down, and we have an S wave, and it never comes back up above the isoelectric line, so it stays an S wave. If it were to come way up above the isoelectric line, we would actually have a second R wave, or an R prime wave. But we don't have that, so we end in an S wave, so this is a left bundle branch block. If we have a terminal S wave, it is a left bundle branch block. If we have a terminal R wave, it is a right bundle branch block. So if we look at V1 on the right bundle branch block characteristics, we can see that the first deflection is an R wave, and then it dips down below the isoelectric line, so we have an S wave, and then it comes way back above the isoelectric line, so we have another R wave, also called R prime, and it doesn't ever dip back down below, so we don't have another S wave. So this is an RS R prime, which is very characteristic of a right bundle branch block, but you don't need to have an RS R prime. If you actually had a lead V1 that looked like this, this lead this V6 lead on the left side, where you just have that big R wave with bunny ears, that is also would be a right bundle branch block. You don't need that RSR prime. You can just have a big R wave and lead V1, and that makes it a right bundle branch block. So it doesn't matter what the beginning or the middle of the QRS complex looks like. It only matters what it ends with, and if it ends with an S, it's a left bundle. If it ends with an R, it's a right bundle. So if we look at this, the only lead that really matters right now is V1. So if we look at lead V1, we see that it is in fact wider than 3 little boxes, the QRS complex. And this one doesn't really go up above the isoelectric line at all. There's no R wave. This is just a big S wave, right? So this is just an S, and we see that it doesn't go above the isoelectric line before going out to the T wave. So this is just an S wave, meaning that this is a left bundle branch block. If we look at this one, we see that dipping down below the isoelectric line, we have a little Q wave, and then we come up and have a big, tall R wave, and then we go out toward the T. So it ends in an R, so this is a QR wave, but it ends in an R. Doesn't matter what it begins with, it ends in an R, so this is a right bundle branch block. This one right here, hopefully you can see that this is a fast left bundle branch block. Some people would actually think that this maybe looked like VTAC a little bit, especially because it's it is indeed pretty fast. It's 160 beats per minute, but this is actually just an SVT with a left bundle branch block. So let's look at some heart blocks. They can be very confusing, but hopefully we can break them down and make them a little bit more simple for you guys. But remember, anything to do with heart blocks, regardless of what the EKG says, you need to treat your patient, right? We don't treat bradycardic EKGs. We treat symptomatic bradycardia. So it doesn't matter if this patient's heart rate is 41 or 38. If they are pink, warm, and dry, and they are not short of breath, and they do not have chest pain, and they are not lightheaded, and they are not nauseated, then they do not need to be treated for their bradycardia. But if they are bradycardic and they are hypotensive and pale, or have chest pain or have shortness of breath, then absolutely we need to be treating that bradycardia. So let's look at this first one. So a first degree heart block, or a first degree atrioventricular block, because when we talk about heart blocks, that's all we're talking about. We are talking about how well the AV node is working. And a first degree block, the AV node is starting to not work very well. So we can think of the AV node as kind of the marriage between two people, the marriage between the atria and the ventricles. Just for the sake of this story, we'll call the atria the husband and the ventricles the wife, and the wife is at home waiting for him. So when he gets off work, he used to come right after work. He used to get off work and come right home. But now he is kind of staying at the office a little bit late, right? So every night that he comes home, he seems to be coming home at like 9 or 10 o'clock at night. But he does seem to pretty consistently come home at the same time every day. Maybe he's just taking the long way home because he doesn't want to get into an argument. So this isn't necessarily a failing marriage yet, but this is definitely an unhealthy marriage. And we need to be watching this person. When we get into a second degree type 1, also called a Mobitz 1 or a Winkie-Bach, now the marriage is getting a little bit less healthy. So he maybe had like a big fight with his wife the night before, and now he comes home feeling really bad. He comes home like pretty well on time, but maybe, took the long way home. But then he gets back to his old ways, and he's staying later, and he stays later and maybe goes out and has dinner with some friends. And then a few nights down the road, he just decides to not come home at all. However, you can see that he feels really terrible about that. So the next night he comes home right after work. That's a pretty unhealthy relationship, but really he's coming home almost every night, so it's not as bad as it could be. Second degree type 1 is the longer drop, and you can hopefully help to solidify it in your mind with this little marriage story on he takes longer and longer to come home every night, and then finally he doesn't come home. He feels super bad about it, so he comes home right on time the next night, but then he's back to his old tricks on staying later and later and later until he just doesn't come home. This marriage is going to start to deteriorate quickly, but they do a little bit of marriage counseling and they decide, you know what, if you are going to go out gallivanting with your friends, then go ahead, don't come home. But if you're not going to go out with friends, then you're going to come home right on time. And so that's what he does for a little while, right? So we get into the second degree type 2, which is the marriage that's being counseled. So if he does come home, he's going to come home right after work. But then if he wants to go out and party, he's just not going to come home. So typically a second degree type 2, you'll see a patient that is much sicker than a second degree type 1. A lot of people would think that the longer drop, that second degree type 1, would make, or you'd see sicker patients. But in reality, a second degree type 2 is oftentimes a lot sicker. And the reason is because as this relationship between the atria and the ventricles starts to become more toxic because that AV node is just not functioning anymore, the husband will not come home more and more often. So on this EKG strip, you see that he comes home most nights, but oftentimes you may see one QRS complex and then you'll just see 2 to 3 P waves where they drop the QRS completely. And so he may come home one night and then not come home for 3 nights, and then he comes home for 2 nights, and then he doesn't come home for 2 nights. So it can be regular, it can be irregular, but oftentimes you may start off looking like this, and then it gets sicker and sicker and sicker to where this patient becomes more and more bradycardic, and eventually they just get a divorce. And now, once they've been divorced, we enter this third degree AV block. So a third degree AV block means that the AV node is absolutely no longer working. We have the top of the heart doing its own thing, and we have the bottom of the heart doing its own thing, and they absolutely do not communicate or hang out with each other anymore. So you'll notice that because they are not fighting anymore and has lost all of his friends to his now ex-wife, the husband doesn't have anything to do, and so he ends up getting off work and he comes home at the same exact time every single day. You can see that these P waves are perfectly marching out, but they do not coincide at all with what the wife is doing because she is doing her own thing and living her own independent life. So you see that the P waves are marching out and the QRS complexes are marching out, but they are 2 completely different hearts. You've killed this AV node, you've killed the marriage between the top and the bottom, and now you have 2 completely separate hearts that do not interact with each other at all. All right, guys, so hopefully that those stories helped you with your heart block. So first degree, coming home late every single night, but really consistently. Second degree type 1, coming home later and later and later, and then eventually doesn't come home at all. A second degree type 2, if he's coming home on time, but he keeps on not showing up. And then a third degree block, they finally stop counseling and they just get the divorce that they've been wanting for a long time now. And the P waves are doing their thing and the QRSs are doing their thing, but they are definitely not doing it together. If you guys have any questions, feel free to reach out at akaiser@phiairmedical.com, and we will see you guys on part 3.